This video is going to cover briefly the principles of evidence-based medicine that is detailed in Chapter 15 of your textbook. The objectives are to define evidence-based medicine, to identify the steps involved in evidence-based practice, and to illustrate the purpose of evidence-based practice, as well as identify the hierarchy of evidence and discuss strengths and limitations of evidence-based practice. Complexity of treatment options is increasing. And as a result, evidence-based medicine is critically important because it provides a framework for answering clinical questions. It's an integration of best research evidence with clinical expertise and patient values. Clinical expertise being insight and intuition acquired by a seasoned practitioner, and patient values, subjective beliefs and attitudes related to healthcare choices held by patients. Steps in practicing EBM contain the following. 1. Asking an appropriate and answerable question. 2. Finding evidence. 3. Appraising evidence. And 4. Applying evidence to practice. The PCOA model for studying answerable questions is P, patient or population, I, intervention, C, comparison, or O, outcome. If we use this model, it'll be able to help you define these types of answerable questions. Then we go in and we search bibliographic databases such as Medline, PubMed, etc., which we will have more detail about in a separate session. Then we're going to appraise the relevant evidence. So we're going to look at the internal validity, the degree to which the study establishes a cause-effect relationship between intervention and outcome. We're also going to look at the hierarchy of evidence, a system that ranks the relative reliability of different types of evidence. This figure is really nice from the textbook that kind of shows you the hierarchy of evidence. So going from at the bottom of the pyramid, least reliable to most reliable. So being the least reliable is your own opinion or somebody else's opinion. Then you have case series and case reports, case control studies, cohort studies, then you get to randomized controlled trials, and lastly at the top is systematic reviews and meta-analyses. Now that we've evaluated the evidence, we're going to apply it. So this has to do with the external validity, the degree to which the study results can be extrapolated to other populations. We're going to determine if the results from the study are clinically significant. So are the findings important enough to be considered when making decisions about patient care? And we're going to determine if they're statistically significant, which is different than clinically significant. So statistical significance has to do with if the findings that are unlikely to be due to chance may or may not be clinically significant. So just because something is statistically significant doesn't mean that it would be clinically significant. And determination of clinically significant really is a subjective process and will come with practice and as you get better with your expertise and the experiences that you have as a pharmacist. If something is clinically significant, then it will always have been statistically significant. There are several advantages to evidence-based medicine. It attempts to find interventions that work, not those that should or seem to work. It improves ability to keep up with new information. It fosters communication with other clinicians. However, there are disadvantages to EBM as well. It focuses on whether an intervention works, not why it works. It requires specialized knowledge, skills, and support mechanisms. It may be perceived as cookbook medicine. Many important questions do not have adequate evidence to inform decision-making. The role of the pharmacist in EBM is that if you have a proficiency in this skill, you can help make more valid recommendations for treatments for patients. Skilled practitioners of EBM can more easily keep up with the changing landscape of drug therapy, and pharmacists can help ensure that research findings are incorporated into practice. In summary, EBM incorporates evidence with clinical expertise and patient values. It is a 4-step process. It has strengths and limitations, and probably most importantly, pharmacist knowledge of EBM can help ensure patients are more likely to get helpful treatments and less likely to get ineffective or harmful treatments.